And welcome to the next video on COVID-19 Survival Guide for Nurses and Healthcare Professionals. And I was very concerned about what was happening to our nurses out there, you guys out there. And so I researched and I was trying to figure out, how does this all make sense? It's unconscionable to me that a hospital would put you in a position where you don't have proper equipment. Well, it turns out that Mady Stovall, our next guest, who's a PhD candidate, has dedicated her career to learning about this. And so it even has a name, and she's going to explain it to you. And then hopefully at the end, we'll talk about some solutions but I want you to know right now, everything you're feeling is completely normal, and it is described in the literature. So Mady, welcome.
Hi, thank you so much, Lorie, for having me. I really appreciate this opportunity to talk about moral injury and the morally injurious experiences that our workforce and our nurses specifically are experiencing right now.
So what is the term moral injury? I hadn't heard about that till I met you.
Well, so moral injury is, well, first off, in order to experience a moral injury, you have to experience what's called a morally injurious experience, which is where you actually experience something such as perpetrating or failing to prevent or even bearing witness to acts that transgress deeply held moral beliefs or expectations that can be deleterious to the individual nurse in the long term. And these can be emotionally or psychologically, behaviorally, or even spiritually or socially disruptive to your spirit and your social and emotional self. And these morally disruptive events are difficult to reconcile and give meaning to things that are consistent with our own worldview. And then these violations that we witness or observe they actually have value, and giving them beliefs and meaning in after we witness them is difficult. So after we've witnessed these, we begin to experience guilt and shame, and this contributes to what's called a moral injury, which is defined as I'm sorry, I'm kind of nervous because I've never been interviewed on my work before. So
It's all good.
I feel a little bit of imposter syndrome here. A moral injury is where you have a betrayal of what is right, a feeling of a betrayal of what is right by someone who's in a position of authority, or even by oneself in a high stakes situation. So obviously, we have people who are in leadership positions. We are also, as nurses or healthcare providers, we are in leadership positions ourselves every day in, day out, in every decision that we make. And every time we set foot into a hospital or any kind of clinical situation, we are in a position of authority over a patient or over an unlicensed assisted personnel, but we are ultimately in a position of authority. And so we have the opportunity to bear witness to or transgress other people. And right now, in this COVID-19 crisis, we are ultimately feeling that we are not only betraying our patients, but that we are being betrayed because our hospitals and our workplaces are failing to provide us with the minimum we need to be safe ourselves. So we're frightened. We're frightened for ourselves. We're frightened for our families. We're frightened for our patients and the general public. And so it's a very uncertain time for everyone.
So, well, I mean, your um, research, and I believe your dissertation is on this topic. But how did, and like this is like the perfect timing, and it would seem like this research would come out of this event, but you've been doing this before. So what got you interested in this topic?
So I came to this work because I was interested in patient safety incidents and medical errors. But in the broad context of patient safety. But also patient safety doesn't necessarily have to do just with, say, medical errors or medication errors. Patient safety is a very broad genre, right? So that's what led me down this area of interest. And so patient safety can be very broad, like we're even witnessing right now. Again, that's what led me into this area of interest. And I came to this area of interest through my own experience with a patient safety incident. That's what led me to be so passionate about it, because I felt betrayed myself by some of the people with whom I worked. I myself felt that I had not only betrayed others, but that I had betrayed myself. And then I also felt that the system had betrayed me. And so it's a very complex feeling. And then I thought, well, by golly, then there was this term second victim floating around out there. And I thought, well, I don't like feeling like a victim, and I surely don't like being called a victim. And so I felt that there needed to be some reframing of this terminology, because it's a very trapping term. It's difficult to recover when you are being labeled a victim, right? It's a conundrum when you're stuck in that term. And so my husband is a philosopher, and my husband was actually my husband's an ancient Greek philosopher, and so he was doing some work in some area of ancient Greek philosophy, and doing some reading in the area of Jonathan Shea's work in this book called Achilles in Vietnam. And my husband said, I think you really should read this book called Achilles in Vietnam. And so I read this book, and I thought, oh my God, I was actually undergoing psychotherapy at the time for PTSD because of my own experience.
Mm-hmm.
And my husband said, you don't have PTSD, you have moral injury. And after I read this book, I said, holy rabies, he's right. I have moral injury, and my whole world shifted. And I said, nurses who have been involved with a patient safety incident have moral injury. They don't have PTSD. Now, as I've done my own research through the years, I've come to recognize that no, you actually can have PTSD or moral injury, or a combination of the two. And that's what the research actually shows as well, in both the military as well as the nursing context in which I've done the research. And so it's really interesting to see how that has unfolded. But so in the work that I've done, what we've been able to show is that there are core symptoms of moral injury, which are guilt, shame, loss of trust, and an existential or spiritual crisis, right? So, and I think we all in this COVID crisis can feel that, right? You come home from work and you feel guilty that you didn't do enough, right? You feel shameful that something went wrong and you should have done something differently. And guilt and shame are very closely related concepts. They're very difficult to separate, but they are related, and they are different. One is more inward and one is more external. Loss of trust can be losing trust in myself. Can I do this again in the future and do it right? Or do I trust, are other people going to trust me again in the future to do this correctly? Do I trust other people to do this correctly? Do I trust to delegate this differently? So trust is a very complex term as well.
Right.
complex concept. And then existential or spiritual crisis, did God, do I trust that, why did God make me do this? Or why did God let this happen? And do I, a lot of people lose faith because of pandemics, and right, there's a lot of fear and anger and loss of trust in their faith because of this pandemic, for example. Then there are secondary symptoms of moral injury, which can be things like depression, anxiety, social problems like money problems, difficulty with your spouse at home, difficulty with managing your relationships in the workplace, sexual problems, just work-home interactions, so to speak, the suicidal ideations, and even going forth and committing suicide. And we've seen that, especially with the number of posthumous reports with second victims committing suicide. And a number of other, like we can say a change in your worldview, right? A lot of people, we see change in personality, burnout, a lot of other symptoms in that secondary sort of symptoms of moral injury. But, rather than focusing on all of what is moral injury, because I think we all really feel that.
Especially
when you're
now.
in it, you feel it.
Yeah.
We feel it, right?
Right.
Well, what do we do about it? What do we do about it? And I can tell you, it's really hard. You can't really recover from moral injury when you're still continuing to experience the hammer beating on the nail.
Yes.
As long as you are continuing to experience that trauma day to day, you're not going to be able to recover. But what you can do is you can make sure that you are creating a strong moral community around yourself, to make sure that you are decompressing on a regular basis. Recovering from moral injury, first and foremost, requires that you name the trauma, that you recognize what it is that is the problem. And I think so long as we're in this problem, there's so many different betrayals occurring simultaneously,
Right.
that we are all suffering, and it's going to be difficult to actually stop and name all of those complex betrayals that are happening around us. But most importantly is that we do not fall, and is that we do not fail each other. We have to rely upon each other and recognize that our greatest strength is in each other as a community. And
we're seeing that in nursing units. People are coming closer together more than ever before. They're working much stronger as a team with everybody, not just nurses. And unfortunately, it takes a bad situation to get some good out of it, because there's both ends of the spectrum. There's lots of bad occurring and lots of good.
Yes.
But
I think that's where the hope lies, is recognizing that there is so much good to come from bad.
And I'm hoping that that hospitals will value nurses more than ever before and appreciate you and take care of you in the way that they should after this, because they know how important it is. They're paying $10,000 a week for nurses to come to New York. They're putting them up at the Four Seasons. But it shouldn't have to take a crisis to get to this point.
Yes, I agree. Well, I think when we look to the literature about how to recover from moral injury, some of that comes from things like theologians, like Larry Kent Grant wrote a book on moral injury. He's a theologian, and he says that there are 4 pillars to healing and resilience in moral living. And those are called the process of naming, reframing, enacting, and revising. And that's how we heal our moral injury: naming, reframing, enacting, and revising.
What
And
are
then
you talked about naming it, so naming the different betrayals.
naming the different betrayals is really important, and then reframing them. And so that means really recognizing what was the context in which they occurred, and trying to understand that I was not in control in all of those, right? And so that that in most circumstances you probably were not in any control, and so that helps to be able to relieve the blame and the shame that often comes along with the feeling of that moral injury. Then the enacting is where you create that strong moral community. And so oftentimes the enacting means that you have to create a new moral community by finding a therapist. And that means that and then also creating a new community where you disclose your feelings of moral betrayal. And so that means that you need to honestly and proactively share your feelings of what it is that you feel that you did that was wrong. And so you need to find someone with whom you can trust, that you can share your feelings. And oftentimes that means creating a new environment, a new community of nurses that with whom you can share your feelings, that you can all share together. And maybe that's not the people with whom you've been working, or maybe it is, but it means you have to create a new environment where you can share your stories. Penna Baker is a researcher out of University of Texas, Austin, who has done research on disclosive writing disclosures, where you write your stories, and it's demonstrated therapeutic benefit of disclosure writing. And so this is also in line with that. But absolutely, the evidence that Brett Leitz and his group have shown, and others have shown with disclosure, is critical to recovering from moral injury. And then revising is part of that last part of recovery, is where the nurse actually has to go back to work and create new memories of creating new mirror neurons in the workforce, of doing something new with someone new, and working and being successful in the workforce doing something else. So again, while we're in this crisis, that's not going to happen, but knowing and having hope that when this crisis is over, we all have it within us to do that. These are some tools that we have to think about, okay, when this is over, this is how we can do that.
And that's great. And it's so important. If you go to your EAP, get a counselor, whatever you need to do. This has been one of my big pet peeves about nursing for a while, is that when there is a trauma, like in Las Vegas, the nurses don't get any support after it. Or the shooting in the temple in Pennsylvania, and Jewish nurses and doctors had to take care of this guy, but no support. But yet, if there's a school shooting, you better believe they bring in the chaplains and the counselors and everybody to help these kids. And I think the same should be of nurses, because what happens is we tend to just wall off our feelings and move on to the next thing, and we're great at it because it keeps us moving and helping people. We couldn't break down in the middle of the shift because, God forbid, we have other patients to take care of, but that's not healthy at all. And so I would strongly recommend Mady's approach about getting the help that you need, because, for you to keep, if you carry this with you, with PTSD and this moral injury, you're not going to have much of a career left. So I strongly encourage you to go get the help that you need, because you'll be able to function better, you'll be happier, more fulfilled, and can move past from this with the right help.
Definitely.
So maybe I have a true confession. I did hear the term moral injury before. I don't watch TV much, but it was on the show The Good Place, and it's which is a NBC comedy about how these people thought they were in the good place, but it was really the bad place after they died. And one of them is a philosopher on moral injuries.
Hey, that's great. That's great.
So do you have anything else to share with nurses about how, now that they can recognize this, and what else to do about it? Or how can they learn more about it?
Well, again, I just had, there's an article that just came out in Journal of Nursing Scholarship that I just published on, it was a literature review on moral injury. And so I'd be delighted if you read that. I think it's a great introductory article on moral injury. And then there's a YouTube talk that I gave from Women's and Genders Trauma Studies. And then, I'll be happy to give you some, I'll give you some references that I've talked about here. I'll give you the citations so that you can post those to your website here, Lorie,
Yeah,
today.
thank you. Yeah.
But yeah, I mean, I think the work that you're doing here is great. And, I will definitely continue doing the work that I'm doing, because I know that nurses are suffering physically as well as existentially in this time. And I've been a nurse for a really long time, and I've spent a lot of that time on the front lines. And right now I'm spending most of my time behind a keyboard, just typing away, trying to, put my thoughts to paper. But I'm definitely there in spirit with everyone on the front lines. And, I'm just really honored to be here with you all today to get to talk about my work. And I hope it makes a difference in at least one person's life.
Yeah. Well, thank you so much. And for all you nurses and healthcare professionals out there, thank you, thank you, thank you. And I hope that this video gave you some context as to what's going on, that it really is a known phenomena, and some tools that you can learn from it to use it to move forward from this, because this isn't going to last forever, but you've got to take care of yourself. And if you're enjoying this video series, please share it, empowerednurses.org/COVID. If you're like, yeah, that's me, that's exactly what's happening to me, this moral injury, share it. Let other people know that it's okay, that this is normal part of, it's a normal part of what we're experiencing right now. So again, thank you for all you do, and thank you, Mady, for all you do. And I love you guys. Bye.